Well, COVID-19 vaccines are rolling out quicker than ever in Saskatchewan. Additional shipments are arriving in larger quantities earlier than anticipated, and Saskatchewan set records this past weekend for single-day vaccination uptake. But as the jabs go into arms, one University of Saskatchewan professor is noticing a trend. Women appear to be taking the vaccine more than men, significantly more in some age groups. Kyle Anderson is the professor who's taken note of this. He works in the Department of Biochemistry, Microbiology, and Immunology at the University of Saskatchewan. He's on the line now. Hello, Professor Anderson.
Hi, Garth. Nice to be here.
Professor, what age groups are being most affected by this gender gap?
So it really varies by age, and we can imagine that there's reasons per age. So right now, in the 18 to 29-year-olds, not everyone has had access to vaccination. So the reason that women are 12% higher vaccination rate than men might have a lot to do with them being in healthcare professions. But if we were to say, okay, let's not look at the really young where maybe employment has had that difference. If we were to look at something like 40 to 49-year-olds, 62% of women are vaccinated and only 53% of men. So that's a 9% difference. And we've all had access for at least 3 or 4 weeks. I know that I was vaccinated 3 weeks ago, 3.5 weeks ago. So it's not just employment, but it's also somehow the behaviors of women and men that are causing this difference.
Is this a trend that's particular to Saskatchewan, do you know?
This is really I don't want to say worldwide phenomenon, but Canada-wide, at least in the public data that Canada releases for women versus men. And in the U.S., we're seeing that as well. So I can give you an example in the U.S. South Carolina publishes nicely their sort of breakdown by ages and gender. Right now, ages 25 to 64, 57% of the vaccines have gone to women and only 43% to men. So 4 out of every 7 are women, 3 out of every 7 are men. And that's going to be a problem when we think about who's going to be vulnerable into the future.
Why do you think this gender gap exists?
So there's a really big body of sort of health evidence or healthcare sort of studies saying that men are more likely to avoid sort of preventative medical appointments to get even just regular flu vaccination. There's generally about a 10% gap between women and men for seasonal flu. And just sort of preventative things, going to the doctor, maybe sort of showing a bit of weakness or showing a little bit of vulnerability. And what I really want to sort of focus on is try to reframe that it's not vulnerable to get vaccinated. It's protective for you, for your family, for your coworkers, for your kids. And if we can sort of reframe that in some of these vaccine-hesitant men's minds and say it's actually a show of strength to try and protect people and look after yourself, we might be able to sort of catch up these men so that we can get the same rate as women.
You've called this a toxic masculinity problem. Why is that?
So this isn't that masculinity is toxic, but thinking about the performance of masculinity can be toxic. And in the case of becoming more susceptible to COVID, to hospitalization, to death, definitely it's the performance of being masculine or sort of falling into those masculine roles, which can lead to more adverse health outcomes. There's actually a study that came out of the States where they looked at how likely people were to be vaccinated or not, and they had men rank themselves from completely masculine to mostly masculine to, partially masculine, and they found that it wasn't just men were less likely to be vaccinated, but it was the ones who rated themselves as completely masculine. So somehow in their sort of gender identity or their performance of being a man, that made them less likely to be vaccinated.
Have you encountered that sort of hesitancy towards the vaccine from any men in your life?
My father did not want to get vaccinated, so he's, up in the 70-year-old age group and sort of said, don't really believe all this COVID stuff, and vaccines not tested, and, had some good talks with him, and eventually he did become vaccinated, and it's because he's high risk up in the, 70-year-old plus age. But when we think about tackling vaccine hesitancy, we can try and send messages to everyone, but we also need to say, each person might need their own individual message. And if you are a guy checking in on your guy friends and saying, I'm getting vaccinated, here's why it's important to me, those one-on-one conversations can go much, much further in trying to get people vaccinated than just sort of an ad that goes out to everybody.
Okay, well, if we're looking at numbers that indicate that in some age groups, we're just looking at just over 50% of men receiving the vaccine, even though they're eligible. What impact could that have on, getting us out of this pandemic, on developing that herd immunity?
Yeah, so, we like to think about herd immunity as a population-wide thing. If all of us can get 70% or 80% vaccinated, but we also need to remember that it's very local, where a workplace, a sports team, a, particular activity that people might be doing, if you have a very low concentration of vaccinated individuals in that group, that means you can have super spreader events. If most of us are vaccinated, but, just in that one hockey team, maybe they're all going to be really vulnerable. You're not hitting that 70%. Maybe they're only at 30% or something like that. So we don't want to just have, the average vaccination rate across the province, but we want to make sure that all age groups, all genders, all, national origin, whatever it might be, everyone is getting that 70, 80%, because the faster we all get vaccinated, the faster we're all out of this, going back to no masks, no social distancing, enjoying our lives and hopefully forgetting that COVID happened, or at least acting like it didn't happen.
Okay, well, what do you think needs to be done to close this gender gap?
Some of this gap is going to be just rate. It's going to be, it might take men a little longer to get vaccinated because they need to be convinced. Maybe their employment doesn't allow them the same access to take time off. But, the earlier we can try and get the messaging out there, try and have initiatives maybe to bring vaccines to where the people are. Pop-up clinics in the States are going on at places of employment, at churches. If you had a tournament, you might say, they might bring vaccines out there, and we could say, let's make sure that, right now people go to the vaccines. But pretty soon, once we have this sort of flood of availability, we're going to need to start thinking about bringing vaccines to where the at-risk people are.
Professor Anderson, thank you for your help today.
Yeah, thank you very much.
Kyle Anderson is an assistant professor of biochemistry, microbiology, and immunology at the University of Saskatchewan. CBC's Alexander Kwan will have a story about this vaccine gender gap on our website tomorrow. Read it tomorrow by going to cbc.ca/sask.